Well, let's focus, as we normally do at this time, on rising COVID-19 infections, particularly here in Gauteng. Now, the national picture has just been updated for the past 24 hours. New cases across South Africa, 13,347. Here in Gauteng, quite a bit higher than yesterday, 8,925. And very sadly, 226 more deaths from COVID-related complications in the past 24 hours. Well, I'm joined now by Dr. Harsha Somaroo, who is a public health medicine specialist at Wits School of Public Health. Doc, thank you so much for your time. So the numbers for this evening, they've just come out. They are a little higher than yesterday, and that death, those deaths is quite a lot higher than yesterday. Are we still in the very worst of it, do you think, here in Gauteng?
Hi, good evening, Sally. Yes, I think we're in the midst of the third wave, and it's quite a severe wave as we've seen thus far. The transmission rates have been quite much higher than previously, and I think the numbers this week are in keeping with what we've been seeing. I think, as you know, the Delta variant has been implicated in terms of transmission in the country and including in Gauteng. The NICD released revised figures from June in terms of the genotyping. And yeah, I think what we're seeing is really due to a combination of factors, and especially due to the Delta virus.
We're also seeing a positivity rate. It's higher, of 26.2%, which means that over 1 in 4 tests done are coming back positive. What does that tell you, and why is that such an important figure?
I think that's quite important because it gives us an idea of the amount of community transmission that we are seeing. One thing that we look at is the actual number of tests done, and the actual number of tests done has been increasing. And of these higher number of tests, a higher number have been positive as well. In fact, in Gauteng, for the past week, we saw a positivity rate of 36%. So over 1 in 3 tests that were done were positive. So it really indicates widespread community transmission at this point in time.
Just taking a closer look at other provinces, I'm seeing Western Cape on 992 new infections. KwaZulu-Natal suddenly jumping to 947. I spoke to Prof. Salim Abdul Karim, and he actually yesterday said he has real concern for KwaZulu-Natal because there are a lot of people in that province, as there are here in Gauteng, and there are a lot of metro areas. Do you share his concern about KZN?
Yes, certainly. I mean, there's various factors that increase the risk for transmission of the virus. One, as Prof. Abdul pointed out, is the high population density in KwaZulu-Natal. The other thing of note is that I think the CRISP team released genotyping results, and it's very representative results for the province, and they found that the Delta virus was actually prevalent in all districts in the province. So I think at the moment it's really important for people in KwaZulu-Natal to really adhere to the non-pharmaceutical interventions, to avoid gathering, to really protect themselves, because like we always say, the virus only moves if people move, and so the power is really in their hands to prevent rapid transmission in the province. They already have a high risk factor in terms of the Delta variant being prevalent in all districts. And all you need is small clusters of outbreaks for it to start spreading exponentially like we've seen in other provinces.
Yeah. Can you update us on what you're hearing about the hospital situation here in Gauteng? Yesterday we heard that actually the real issue is beds and staff to look after the people in those beds. But oxygen is not a problem because we don't have enough beds because large parts of Charlotte Maxeke, for example, are still closed.
Yeah, I mean, I think there have been a lot of challenges faced in Gauteng over the past few months. The closure of Charlotte Maxeke being a big challenge for the province. They did cater for a large number of COVID patients previously, and they also have a large number of ICU beds as well compared to other hospitals. But I think overall the province has put in interim measures to plan for extra bed capacity. But as you mentioned, there is an issue of adequate staff to man all the new beds that have been brought online. And I think in terms of the hospitalizations that we're seeing, there has been a lot of strain on both the public and private sector in the past few weeks. I think people are still going to continue to do everything that they can to make sure more beds are brought online, and the different categories of beds are probably put into the system so that the hospitals can be reserved for the more serious cases as well. Yeah, but it certainly is a very challenging time that we're going through. But yeah, despite that, I think the healthcare workers and the provincial managers are really working very hard to ensure that there is adequate bed capacity for what we expect to see in the next few weeks.
Yeah, well, thank you so much for joining us this evening. That was Dr. Harsha Somaroo, Public Health Medicine Specialist at Wits School of Public Health. Just to recap those new numbers, nationally we've got 13,347 new cases. 8,925 of those are here in Gauteng. So Gauteng is still very much carrying the bulk of those new infections, and 226 more COVID-related deaths overnight.